countless calls have taught Aurora Fire Rescue one thing: anyone can save someone.
So we want to be able to wake them up and get them breathing ahead of time.
Dr. Eric Hill just wants to make sure people have the right tools to do so.
If we can't prevent the death from occurring, there is no chance of recovery, no chance of treatment in this situation.
Dr. Hill is the medical director for Aurora Fire Rescue. After the department saw more than 300 suspected opioid-related overdoses in 2025 and administered naloxone, an overdose reversal drug, more than 500 times, it was a different number Hill looked for. How many naloxone kits can he get?
This gives us an opportunity to make an intervention which can hopefully prevent a death should there be a future overdose.
This week, Aurora Fire Rescue rolled out a new Narcan Leave Behind program. First responders will now have extra boxes of naloxone stocked on their rig to give to people who have experienced or witnessed an opioid-related overdose. The 950 kits came from a state grant.
Just like that.
What's your message to those who say this is enabling?
I think there's several things around that. I mean, every public health intervention, and it's a fair argument that people have, every public health intervention you do does have some degree of, is that enabling the behavior? This is a last-ditch thing to save your life. So it doesn't make you more safer to do drugs, but if you are in an overdose state, this can potentially save your life.
Hill hopes this does enable people to choose a different path, one that requires less life-saving measures.
Even if 10% less people have opiate-related overdoses, or they don't end up in cardiac arrest, that's the ultimate goal.
Hill says there's no negative side effect to this medication, so if you suspect an overdose and give it, but they don't actually have any opioids in their system, it won't do anything. He adds, even if someone is able to reverse an overdose with the spray, he encourages them to still call 911 and have the person be checked out. Sam and Steve?
Such an incredibly important thing for them to have on hand.
100%. You know, I know people that are social workers too that always carry it on them because you just never know what you're going to encounter, and at the end of the day, it'll save a life.
Yeah,
Well,
better safe than sorry.
That's right.
Jaleesa, thanks.